So March is Colorectal Cancer Awareness Month, one of the most common and deadly forms of cancer. A new report released on Friday warns about a troubling rise of colorectal cancer among younger people. Gastroenterologist Walter Coyle from Scripps MD Anderson Cancer Center and Scripps Clinic here to tell us more about that. Doctor, thanks so much for coming in. Appreciate your time here. Let's talk a little bit about this new report. It found that as of 2019, 20% of new cases occur in people ages 55 and younger, and that's actually up 11% from 1995. Some discouraging information to hear there. Can you dive a little bit into that report, and what does it tell you?
Well, it is the new statistics. If you're born in 1990 as opposed to 1950, you're twice as likely to get colon cancer, and more colon cancer on the left side of your colon as opposed to the right side. And there's a lot of reasons we think that may occur.
Yeah, what would be some of those reasons?
Well, we're definitely more obese, we're more sedentary, and when exercising drops your chance of colon cancer by 20%. And then diet. Maybe the gut bacteria is called the microbiome, and we've changed things with antibiotics exposure and also our food chain. Probably preservatives, emulsifiers, and stuff like that have made a big difference on our microbiome, which affects whether we get colon cancer or not.
So, I mean, once again, doctor, we say it all the time, like a broken record here, but diet and exercise, right? Are those really the ways that we can kind of fight back against potentially getting colorectal cancer?
Fresh fruit, vegetables are very important. Avoiding red meats, particularly things like sausage and the preserves, and all the prepared white and dark meats. And coffee drops your chance by 26% for colon cancer. And then taking vitamin D decreases your chance. So all these things we can do in our diet and lifestyle and decrease this chance of getting colon cancer.
Well, on the morning show, we're big fans of coffee, as you know, so that's good. And when we're talking about coffee, is it just like a couple cups a day? Is that and how and why does that help?
Well, it's probably dose related. And it doesn't matter if it's caffeinated or decaffeinated, and decreases your chance for liver cancer and colon cancer.
Oh, okay. What are some of the warning signs people should look out for?
That's a great question. Any change in your bowel habits, belly pain, blood in your stool, anemia, that type of thing. And if you have a family history, you should contact your doctor about getting screened earlier.
Okay, let's talk about the colonoscopy. The age has moved up, right, for people to get this test, right?
Yeah, the task force in 1991 said we should drop it to 45.
Okay.
So now it's 45 to 75. Everyone should get screened, and then from 75 to 85, you talk to your doctor whether you should get screened.
How easy is it to remove the polyps? I mean, once it's found, the survival rate is pretty good, right? I mean,
if we find it early, we cure you.
Yeah.
And it's very easy. In fact, the cure rate has increased for people for the last 20 years. However, now people are getting it more advanced at younger ages, like Chadwick Boseman, who died unfortunately at age 30. At 43, he was diagnosed at 39.
Wow. Okay. What are some of the different types of screenings? Colonoscopy, obviously. What else is involved in trying to identify the cancer?
Well, there are two big ways to screen. You can do stool-based. There's one you just mail in, another one you mail the whole stool in, and then colonoscopy. They're the three tests we really recommend. And it's important just to get the test. And people are always scared about colonoscopies and say, at least get the stool-based test, and then if that's positive, we'll do the colonoscopy. But colonoscopy has the advantage that it finds the polyps and takes them out before they become cancer. The stool-based test sort of wait till you have cancer or an advanced polyp.
Okay. If people want to learn more, doctor, where can they head to get some more information and learn about the right times to get checkups and everything? Well,
the Scripps Clinic website has all sorts of information about colon cancer screening, but American Cancer Society is fantastic, and then there's a big GI society, gicancer.org.
Okay. Doctor, thanks so much for coming in. Really appreciate your time.
Thank you for having me.
Thanks for keeping us healthy.